Dr. Kahan, let's talk massage, foot massage, obviously because you're a podiatrist. We know massages are very, very good overall because, well, they get circulation going. You have mentioned in many videos how important the circulation, I mean, you don't need to talk about it, we all know it, but you talked about how diabetes has huge effect on the feet due to the fact that feet are difficult to circulate somehow. Anyway, reflexology or whatever that stuff is called. And anyway, a good little foot massage. I'm telling you, my wife, she's not a massager or something, but she gives me foot. It doesn't matter where. She pushes there, and I just go to the ceiling. And she tells me, you are having problems. I say, honey, I don't have problems. And she says, no, you look. It wouldn't hurt. I go, what do you mean it wouldn't hurt? You're putting your fingernail in it. She says, no, I'm barely pushing. I'm a little tiny girl, she says. So anyway, shed some light on massage, feet massage. How are podiatrists involved in it? How are you involved in it? What do you feel about it? What do you offer there, and for what are you offering it?
You know, that's a great question. I love answering questions about topics that we don't regularly, or that I as a podiatrist don't regularly engage in. And I will never tell anybody, no, don't do that. That's silly. That's stupid. You know, guess what? You know what? When I was looking at this, I'm still looking now. Somewhere on this desk of mine, I have a whole sheet of the reflexology points, which I've had for years and years. And you just... By Monday morning, I'm going to have a reflexology chart on my website. I'm going to post it up there. Not that I really believe 100% that every spot in the bottom of the hand or the foot corresponds to, to the colon or the pancreas, but you know what? We're not talking about science that just came. This is reflexology. We're talking about
5,000 years.
Exactly. Thank you. I mean, so guess what? I'm going to say yes, there is merit to it. Do we regularly engage in massaging people's feet in the office? No. However, what I do quite often is I'll use if a patient comes in, certain patients they come in for routine care or such, and if their feet are really dry, I do carry in the office what I call therapeutic creams, and I have some of my own stock that when a patient comes in and their feet just are horrible, when they're done with their treatment, I'll massage them myself, and I'll massage in some of the cream. And I swear to God, it's like if there was a cat there, he'd be purring. So I don't know what it is about the foot, but people love to have their foot massaged and rubbed, and I don't particularly care for it, but there's enough out there that obviously it must feel good. And again, the reflexology points, I am convinced that there is something to that, even though I have not personally experienced it. And again, like you said, it's great for the circulation. It's great for the psyche. If anything that makes you feel better, guess what? Do it. Except for drinking and smoking and drugs. That's too artificial. But, if it's something as simple as a foot massage, can keep you on your feet for another 2-3 hours during the day, boom, have at it. And for those patients that I do it on, I know they love it when they leave. That's the last thing they remember is their foot being massaged, and not that I hurt them while they were trimming a corner of callus.
Beautiful. Well, all right. Basically, I mean, again, as you said, every point in the foot going wherever it is, you might or might not. It might be true, but then again, are we really hitting it and all that? But the point is, if the foot gets circulated which is massaging in the first place all about, if there is better circulation in a part which, you stand on it all day, it's kind of like a little dead, a little stumped on, that's probably what it is, you feel good. And, it may be an extension of wearing good shoes and all those type of stuff, something which doesn't cut your circulation, but at the same, increases it. And, must be good for people with diabetes, because anything which makes their circulation increasing is good, so it does it. So I can see it. So you're sometimes doing it with patients, and you make them feel good. Wonderful. Thank you very, very much.